I would like to introduce to the audience, homie. We had a surgery done before, a year ago. Before homie will share his experience with the audience, I would like to show what his before looked like. I believe his hair result turned out fantastic, very natural and very dense, and no one know he had it done. And his look has changed. He gained at least 10 to 20 years of his youth back. Hair really bring out his natural facial structure. He's enhanced his eyes, his nose, and everything. And that's God gave that to him, but it really brings it out. And before we let him talk and share his experience, I want to show the audience what it looked like before. And that was before surgery. And it's received quite a bit by me. And this is what it looked like a year later. Excellent. Front view, right side view, left view a year later. And so this is my friend homie. So homie, can you share the audience your process, how about the hair loss, your research, and what's the surgery like, the follow-up, and then a year later how?
Yes. Yeah, I went to see Dr. Diep about 15-16 months ago, around April of 2011. Researched about him, saw some of his YouTube work, and investigated about his credentials, and then had a meeting, very pleasant. And then he stated that he was going to enhance the front part of my hair. I had two previous procedures by very prominent MDs specialized in this field. And their work was good, but I went for extra enhancement and met Dr. Diep on the day of the procedure. Very pleasant. There were a number of staff in his office, and all the girls were very professional. Dr. Diep himself took pictures before and after, and before the procedure he gave me instructions about not taking vitamins and drinking and some of the precautionary items prior to the operation. And I was in the office literally for a whole day. I believe there were about 2,700 grafts installed, taken from the donor area and installed mainly on the front part of my forehead. And year and a half later, or almost 16-17 months later, I came back to see doctor, very happy with the result. He had the vision of proper aesthetically arranging the hairs, which give it a natural look. And you know, having had experience with the previous two other MDs, I found Dr. Diep very likable, genuine, professional, knowledgeable. These are the elements that I do really look for, and the end product was very good, and I look forward to, per his direction, have further enhancement at the back of my head area. And all I can say is he's a good doctor and he's genuine, and keep on with the good work. And thank you, Dr. Diep.
Thank you, homie, for sharing that experience with the audience. And it's really going to help the audience and give them a little insight about the process of the surgery and all the stuff. But again, before we go, I just want to go back what's it look like before, and so the audience will kind of know the aesthetic part. And he did have surgery, but the problem is they did the hairline so high. And those are old. I understand the mature hairline, but it should not be half of the head high and does not look normal. You gotta make sure that it looks normal and natural, and that's exactly what it should have. And a year later, and this is what he should have. It's amazing. And this is his naturalness. If he has no hair loss, that's the max his hairline should be, and that's what my goal has been: naturalness and density, and they give him volume. And that's as if he never had hair loss, and that's what my goal is for him. And we will do another procedure to fix the back and go from there. And this is what he looked like right now. And let me show the audience to run his hair through, and it's very natural and dense. Thank you, homie.
Thank you, doctor.